Hey everybody, hope you're doing well. This morning is our second edition of the live question and answer sessions that we're going to be doing for You Fix Pain. So please feel free to post any questions you got now or later whenever you're watching this video. I had one question by a viewer. Let me pull it up right now. Let's see here. It's about knuckle pain and what to do. So, let's see. The name is at O 09 Yuba, and they were asking about exercises you can do for the knuckle below the middle finger. Whenever they grip any tool or anything, the knuckle has pain. So, what I would do, the knuckles are kind of tricky, but there's a couple things that you can do on your own to make them better. So it's not so much about trying to strengthen up your wrist or anything. It's just about trying to get that inflammation down in your knuckle. And so I'm assuming, let's see, middle finger. So I'm assuming it's either here or here that you're having the pain. And so if you were trying to get inflammation down in that area, first you want to see if you can just get it moving by moving it back and forth. And the more that you can do that, that typically will push some of that fluid out of the joint. But another thing that you can do is actually mobilize the joint itself. So what you do is you're actually going to put traction on it. So it's like you're trying to pop your knuckle, but you're going to grip it like you would like a pencil. And what you're going to do is you're going to put your thumb on top and your fingers underneath, and you're going to put traction on it, and you're going to pull away. And as you're pulling away, you're going to mobilize that joint up or down. And at first, what you're going to do is just see if it's painful, and it really should feel kind of good. So I'm going to pull away, and then I'm going to tilt my wrist up. So then you're putting pressure underneath the knuckle and separating this space in here. And you're just going to hold that pressure, and you're just going to oscillate back and forth. You can do that about 20 to 30 times. And then you're going to actually reverse it, pull, and now you're reversing it and pushing down just like that. You can do that 20 to 30 times. Now, if it's on this joint, you're going to do the same thing, pulling, pushing up. Once again, going up like that. If you feel a pop or a creak, that's totally fine. And then you're going to do that 20 to 30 times, and then you're going to pull and then push down like this 20 to 30 times. Now, most people think of their knuckles and their finger joints as two-dimensional, meaning they just flex this way and extend this way. There's actually a little bit of rotation in there. So what I want you guys to do too, if you're having knuckle pain, is don't just pull this way and then mobilize the joint up and down. You're going to pull, and then I want you to actually mobilize the joint this way and towards yourself. So it's same thing. You're pulling traction on it, and then you're going to be mobilizing that joint just like this away from you and then towards you. And once again, you want to do that about 20 to 30 times in each direction. So that's exercise number one. Exercise number two, after you've mobilized it, is try just bending that finger back and forth 20 to 30 times. So just remember, the more mobility you get in there, the more movement you get in there, the more you're going to drive that fluid out. It's almost like spraying WD-40 on your joints. It's like a natural lubricant. So that can be really beneficial. So that's exercise number one. Exercise number two is just getting it moving 20 to 30 times. And then exercise number three that you can do on your own. This is more of a manual treatment, and this is how you stimulate circulation and more blood flow around a joint that's really irritated on your own. And so these are called manual treatments. So what you're going to do is get some lotion. Always use cocoa butter. You can really use anything you want, any lotion around your house. And you're going to lube that puppy up. So I'm just going to do it across my middle finger. I'm going to do this joint right here. And I've got a scraping device. You can use a butter knife. You're just going to use the back part of this butter knife, and you don't want to use a sharp edge because you know that would be uh, painful, and you don't want to be hurting yourself because you're already in pain. But so what you're going to do is you're going to lube that puppy up, and you want to get enough lotion on it to where you're not going to get friction on your skin, or else you start causing blisters. I did that early on when I first learned this technique, and that does not feel good. So I'm just going to show you how to do it with butter knife because this is probably what you got at home. So what you're doing is you're going to put this butter knife not at a 90-degree angle straight up and down. You're actually going to tilt it about 45 degrees and get towards the tip of it. And you're actually going to go all the way around that knuckle and you're just trying to get deep into that joint, and you're going to feel a little bit of grittiness, and it's going to feel a little uncomfortable, but just keep going back and forth at a 45-degree angle, and you're just scraping all around that joint. And where you feel some grit or some bumpiness, just keep going over that area. And then what we're looking for is a change in color. So the change in color is going to indicate that we're getting more circulation. You can tell that it's already starting to get a little bit red, and that's what we want. We want more circulation in there because blood carries a lot of important things like nutrients, oxygen, and it's going to promote quicker healing, better mobility in that joint. So I'm going to spend about 20 to 30 seconds just scraping this area on the top. Now, obviously, it's hard to get into the sides of this joint because you have other fingers in the way. But if you can tell, that knuckle has already started to change colors, and you're going to feel a sense of release and more mobility in that area. So now what I'm going to do is I'm actually going to flip my hand over, and now I've got a little bit of calluses here, but what I'm going to do is I'm going to apply some more lotion on this part of the joint, and then I'm going to do the same thing. And I'm just going to be scraping in this area. That's a little harder to do when you've got calluses. And so when that's the case, I'm not going to turn it at a 45-degree angle. I'm actually going to do the opposite. I'm going to turn 45 degrees in the other way and then scrape in that direction. Because if I turn that knife like this, I'm just going to be peeling off my callus, and I don't want to do that because I like calluses there because I wear out. So once again, I'm just scraping right over the top of that joint with the dull edge of the blade of the butter knife. I'm just going back and forth 20 to 30 seconds, really just trying to stimulate more circulation in that area, which will promote more healing. Now, if you're getting more pain distally, just meaning further away from the joint, like right in through here, then you're going to do the same thing that you did below on this joint. However, you can get the entire joint on the sides as well, which is going to prove to be very beneficial. So once again, you're just scraping at a 45-degree angle here. It's much easier to get into where you feel the bumpiness and the grit. Just spend some extra time there. Get on the sides, get on the underneath part, and on the other side. And once again, 20 to 30 seconds in each area. You're trying to get a nice red tint to it. You don't want to overdo it because you don't want to over traumatize the area. I don't have a towel, so I'm going to have lotion all over the place. But just keep that area nice and lubricated, and spend, at max 2 to 3 minutes on each joint, depending on which joint it is, and that should give you some relief. And then you can follow that up with more movements, just keeping that finger moving back and forth, and more stretching. So you can't really do too much of this mobilization. It should feel good. It shouldn't hurt. Once again, you're pulling away. After you scrape, you're going to do the same thing. You're going to pull away, and then you're going to mobilize up. You're mobilize down. You're mobilize to the sides, and you can do the same thing for this joint and that joint. And hopefully that should give you guys some relief. And yeah, guys, I am here for you every Wednesday. I'm going to be on this channel live, posting and responding to comments, and giving you guys ideas on how you can fix your pain on your own from home. So please, even on this video, post comments below, or any other videos, and let me know what you guys want to learn more about. And I'd love to help you out. So let me know in the comment section. We'll see you guys next week.